The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. Welcome to the 21st of July installment of the Better Building Summer webinar series. It's great to have all of you join us. We have a large group who've signed up for today's session. I'm Michael Friedberg. I'm with HUD's Office of Environment and Energy, and I'll be your moderator today. In this series, we're profiling the best practices of Better Buildings Challenge and Alliance partners and other organizations working to improve energy efficiency in buildings. We hope you'll join us for the remainder of this summer series and stay tuned for the 2021 series that we'll be launching in the fall. So lots more to come. Next slide. So, you know, the importance of this topic has never been greater. We're building homes more efficiently than ever. And as a result of the COVID-19 virus, people are spending more time in their homes than ever, and that's presenting new management challenges for multifamily building owners and operators. And of course, we all know that asthma-related respiratory ailments have been identified as one of the risk factors for the virus. So we really need to be sure that when we rehab our homes, build new homes, and operate existing buildings, we maximize the indoor experience and minimize the hazards. Next slide, please. I don't have to tell this group that health and the indoor environment are closely correlated. Up to 40% of asthma attacks can be linked to home conditions. Thousands of deaths are related to radon. And of course, falls and safety issues are always a challenge. Next slide. So today, we're going to do a short introduction to energy and health. That'll be my piece of the puzzle. I'm then going to hand the baton over to the great panelists that we have lined up for today's session. Then we're going to do some moderated discussion and finally do some Q&As from all of you. So please be prepared to enter your questions and answers, and we will definitely get to as many as we can. Next slide. So obviously, all of us that are in the energy efficiency space know that energy efficiency itself can reduce health risks just by insulating, air sealing properties, heating system upgrades. We improve the quality of the air by removing moisture, can lower mold accumulation, and those translate into fewer asthma symptoms, can impact fewer heart disease risks, and finally, on the right here, reduced hospital stays and medical visits. We're seeing increasing evidence that, that there's this connection. Next slide, please. And of course, when we add healthy housing practices, in addition to basic energy upgrades, we see some additional improvements. This is the BRIGHT study supported by the Office of Healthy Housing at HUD, showing fewer ventilation complaints, 27% versus 89%, all the way to, if you eliminate combustion products on the right, no problems with indoor air quality as far as combustion is concerned. Next slide, please. And we're also now have evidence that these interventions pay for themselves. This is a CDC evaluation that showed strong evidence of the effectiveness of these indoor interventions, particularly when it comes to asthma. In this case, benefit to cost ratio returns of anywhere from 5.3 to 14 dollars on the every dollar that's invested. So there are significant cost benefits as well, both on the health side as well as on the building operating side. Next slide, please. I wanted to mention before we get to our speakers that in addition to today's session, my office, the Office of Environment and Energy at HUD, have launched a Health at Home guidelines and training series that began last month. We'll be doing the second session in this 4-part series this Thursday, actually, July 23rd, where we will be dealing with contaminants and pest-free measures that you can adopt when you're doing a rehab project, focusing more on single-family and low-rise multifamily buildings. So if you're interested in that series, go to the Help at Home page on HUD Exchange, and we will get you signed up. Next slide, please. So today's session is really going to focus on some of the exciting things that are being done by both Better Buildings Challenge partners and others in this space to layer in healthy housing measures and practices, both on the buildings side scale as well as on the community scale. And I think you'll be really interested to hear about some of the innovative work that's being done to better integrate healthy housing and energy efficiency upgrades or new construction. Next slide. So as I said, we want to engage all of you as best we can with a large group of you. So I'm going to ask Becca Curry, who's been a key member of this team, to just talk you through how to get onto the Slido app and also some other housekeeping details, and then we'll get into the meat of the discussion. Thank you.
Great, thanks, Michael. Hello, my name is Becca Curry with ICF, and before we introduce our panelists, I'd like to share a few housekeeping notes with you. Your phone line is on mute today. If you experience technical issues during the webinar, please type them into the GoToWebinar chat box on the right side of your screen. We are excited to announce that today we will be using an interactive platform called Slido for Q&A and polls. Please go to www.slido.com right now using your mobile device or by opening a new window in your internet browser. Today's event code is #DOE. If you would like to ask any of our panelists questions, please submit them at any time throughout their presentation. We will be answering your questions near the end of the session. You can select the thumbs up icon for questions that you like, which will result in the most popular questions moving to the top of the queue. I will give everyone a few minutes right now to open up Slido, and we will be launching a poll there shortly. Next slide, please. So now we'd like to do a quick poll to hear from you. Again, please go to slido.com and type in the event code #DOE to access the poll. So the poll question is as follows. Which of these healthy housing measures is most important to you in addressing health in your energy upgrade projects? Choose up to 3 of the measures you see now on your screen. And we're going to pull up on the screen the Slido poll so we can actually see all of your results live. So I'll give everyone a few minutes to respond. It looks like indoor air quality and ventilation upgrades is in the lead with about 87%, followed by mold and moisture mitigation. Then we have, following that, close in a tie, healthy building materials and mitigate toxins. And then coming up at the bottom, we've got well-being measures as well as integrated pest management. So it seems like indoor air quality ventilation is really what people on this webinar right now are most interested in. So thank you for that. So now I'm going to turn it back to Michael to introduce our panelists.
Thank you for that, for all of your participation. That's obviously good information. Not surprising that indoor air quality really comes out on top. So we will hopefully address that topic in a variety of ways. So now to today's presenters. We have a number of really outstanding folks who are going to be talking today. Drew Vernalia with the Codman Square Neighborhood Development Corporation, Krista Eggers from Enterprise Community Partners, Neil Steinkamp from Stout, working with NYCHA, the New York City Housing Authority, Ruchi Shah with the Tenderloin Neighborhood Development Corporation in San Francisco, and Roberto Valle from the Healthy Building Network. So great to have all of you. They're going to speak fairly briefly, and then we're going to do an interactive discussion and get into some of the issues in a little bit more detail. So the first speaker is going to be Drew Vernalia, who is the asset manager for the Codman Square Neighborhood Development Corporation in Boston. They're doing extraordinary work working with medical and health organizations in that city. Drew oversees portfolio redevelopment, energy, and resident life improvements in their 19 affordable housing properties, both in Boston and in the surrounding area. So, Drew, good to see you on the screen. Thank you for joining us. Over to you.
I'm glad to be here. And hello to everyone. I'm Drew, and I work at Codman Square Neighborhood Development in Boston. And as a community development corporation, we aim to change the community and people's lives. So there's a lot to do. Next slide, please. In my three-part presentation here, I explain the key green planning tools that we use. As a disclaimer, I quickly go over these. So if you want all the great details that you'll see in the slides, you'll have to get you copies of the slides afterwards. I start with green community and organization plans, including strategic operating sustainability plans. Next is green asset management plan that has individual property plans and a dashboard planner. And last, green development, which includes development standards and health action plan. But before we can plan for health, we must understand it. Next slide, please. Of all the factors affecting health and well-being, only 20% comes from doctor care, which is in the left quadrant of this graph. CDCs like us are involved in 80% of health work, which is 30% behavioral, 40% socioeconomic, and 10% the physical environment. Starting on the outside right and going around, our CDC has diet and exercise classes, an urban ag program, child after school classes, safety programs, social events for residents in the community, education on home ownership and finances, job assistance, business advising, financial coaching, savings programs. For transportation successes, we facilitated train stations in Boston, built transit-oriented developments, and walkable, bikeable streets. In our rental housing and affordable homes, we improve indoor air and outdoor air quality, among other things, and last, provide access to care directly in some of our newest buildings. All this relates to health and housing. Next slide, please. So green is the goal in all our plans. And by green, it means always health included and has three meanings to us. The first green is physical buildings, developments, and the neighborhood. Better buildings equals huge financial benefits to us, our neighborhoods, and the planet. It also means validated health benefits such as cleaner outdoor and indoor air, better lighting, acoustics, and thermal control. Although greening the physical environment is only 10% health, we go beyond that doing green communities. We recently achieved a certifiable LEED neighborhood, which encourages biking and walking with street infrastructures, as well as health-nature interactions through sidewalk and property landscapes. The second green is healthy habits, which is 30% of health. Think garden green vegetables like this picture of our urban ag site called Oasis. We promote healthy living for our residents and community. The third last and not the least, green is money, income, jobs, and social well-being. That is 40% of health. So we promote economic prosperity in our many programs. Next slide, please. So to go green for your company, the key is within your strategic and annual operating plans, have sustainability and health goals for all departments. They go hand in hand. Due to time today, I don't show these strategic and annual operating plans, which are fairly common practice, but I share a community sustainability plan. One pointer here is if you're trying to start green, consider a green culture movement in your office by energy conservation, reducing, reusing, recycling, and again, have everyone participate. Next slide, please. So here is our community sustainability plan with all our departments across the top and green categories going down the left. Again, every department should attempt sustainability goals like here you get climate, energy, water, waste, but also health goals like mobility and health, which is at the bottom. There's more. So next slide, please. Most of these, actually 4 of 5 of these are health categories. Ecosystems, food and health, innovation, economy and jobs, equity and livability. So again, you'll have to get copies of these slides, but I'm just showing you. So if we go to the next slide, please. Part 2 is here is green housing. This property featured in the BBC blog got all new LED lighting, solar, boiler retrofits. For health and well-being, it has a new rec area and garden, as you can see in the lower left. We have a computer learning center, it's not pictured here, but that's for education, job assistance. We also started HUD's Family Self-Sufficiency Program for financial coaching and savings. So thank you, HUD. Now let's see how to make a green asset management plan or GAMP. Next slide, please. So a GAMP should have a brief intro, individual property plans like this one, a dashboard, and policy attachments, which may include your green procedures and a green resident handbook. Here's the individual plan for this property I just showed. Notice the 2 columns labeled green practices in place and green practices planned. And then on the left, notice the green and health categories. So commitment, that is, an example is entering the Better Buildings Challenge, climate, electric, heating, water, waste, but also health things such as mobility, health and food, environment, ecosystems, economy and jobs, equity, and livability. So next slide, please. The second main part of our GAMP is my master dashboard planner that combines benchmarking and green planning together. Building engineers, with the help of List, helped me create this awesome tool. At the top, you set and enter performance targets. You copy your property names, addresses, and data from Portfolio Manager, and then the colors indicate building performance. Notice heat, gas, electric, and water benchmarking, but also notice the smoke-free housing and retrofit plan columns on the right. So cut off on the slide here, off to the right, are many more green and healthy planning columns like green cleaning, gardens, water retrofits, solar, etc. Next slide, please. So here is our Waldeck development highlighted, which is uniquely for homeless and high users of medical care. These persons have a staggering cost upon our health care, which is why hospitals are huge donors to housing like this. Namely, you see Boston Medical Center, Enterprise Community, and Boston Public Health Commission are partners. Next slide, please. So no development team should be without development and construction standards. These are the major categories that I included in our plan. So you have planning team, site selection, massing, building programs, landscape, circulation around the site, of course, unit design, building systems, material selection, and culture. Next slide, please. And the last healthy planning tool we have is, and this is Waldeck's Health Action Plan in a summarized format. You have key health issues selected and interventions and strategies. This is the tool that comes from Enterprise Communities. Just take a look, you can see the trouble, you can look at trouble sleeping, for instance, and you can see we've have interventions to enhance safety and reduce noise. So we analyze the locks, the gate safety, and for noise reduction, we have doing window replacements and adding wall insulation. But this is a great tool if you have a property that has a medical site on staff and having a program like that. So that's it for me. Next slide. And that's my contact information here.
Okay, thank you, Drew. That was really interesting. I think we learned a new term, GAMP. GAMP. We have to unpack that later during the discussion. You also heard about the Health Action Plan that Codman Square is developed for that project, and we're going to hear more about that from Krista Egger next, who is the Director of Initiatives at Enterprise Community Partners, managing Enterprise's national green training and technical assistance programs. So Krista, as many of you may know, is obviously closely involved in the Enterprise Green Communities standards and criteria. But I think we're going to be hearing more today about the health action plans that Enterprise is developing with a number of organizations. So Krista, over to you. Thank you for joining us.
Great. Thank you, Michael. Really appreciate it. So as some of you all may know, Enterprise, as an organization, we're a national nonprofit in the affordable housing space, and we develop programs, we advocate for policies, and we deploy capital to promote affordable rental housing. We've been around for about 35 years. We've created more than 500,000 homes, invested more than $53 billion, and touched millions of lives. And we recognize that there's more work to be done to solve for affordable housing in this country. And even though we're solidly in the housing space, we recognize that the decisions that we make with housing impact health. And we like to say at Enterprise that health begins with home. 1 minute, excuse me. Sorry for that interruption. I hope I'm in a quieter space now. So at Enterprise, we say that health begins with home, and intentionally or not, the decisions that we make with design and development and operations influence health outcomes of residents in the housing projects that we're involved in. So a few years ago, we challenged ourselves to think about what framework could we develop to assist and really catalyze the ability of affordable housing developers to consider how their practices influence health. We were inspired by the HIA framework, Health Impact Assessments, which is in the domain of public health, and we were inspired by the integrative design process, which is in the domain of green building, and with those two processes created the Health Action Plan framework. And so I'm going to share with you a little bit about the two key inputs that are really non-traditional in affordable housing that go into the Health Action Plan process, and then how we're working on scaling it. So you can go ahead and move to the next slide. And I'll share with you that the first non-traditional input in some ways in these health action plans is getting input from community stakeholders. So while involving stakeholders in your development process may be a part of your process today, we've found that it's not common for affordable housing developers to really query the impact of community about what aspects of their health are of most priority to them when it comes to how the built environment influences their health. So that's a key component of the Health Action Plan process that we've involved. And you can see here on the screen some of the examples of the benefits that this provides, from lifting up health concerns that you would not be able to discover without this person-to-person conversation, building relationships, building power and agency for residents, etc. And we've actually found that through many of our Health Action Plan engagements, mental health issues come up more often than not in this community stakeholder involvement phase, such as social cohesion and connection to community members, which you would not be able to solve for unless you're able to identify it through this process. So that's community stakeholder involvement. And then if you go to the next slide, the other key input that's non-traditional for affordable housing development is bringing in a public health professional. So bringing in someone from outside the housing space to provide their input in your process of development. So when we're referencing public health professional, that person can come from many different backgrounds. It could be an organization, it could be an individual, they could work for local public health departments or universities or private practices, they could have many different titles. But the key is someone who has experience in accessing and analyzing community health data so that you can evaluate what the needs are in your space, that they have experience in engaging community members in assessing health priorities, and they have experience applying this information to housing so that they can speak housing, if it were. So if you move to the next slide, you'll see the Health Action Plan process as it comes together. First, housers commit to prioritizing health in their development process, then partner with a public health professional, then go through the data analysis phase, and then engaging with community stakeholders, then identifying different housing retrofit strategies or new construction strategies that can respond to those needs that they identified, and then measuring that over time. So if you go to the next slide, I'd like to just highlight for you all how we've tried to move from just concept to piloting to really scaling this Health Action Plan process in affordable housing. And we've been approaching this scaling concept at Enterprise by merging with my colleagues at Enterprise who have expertise in managing capital funds for affordable housing. So we were really thrilled to announce last year the launch of two new funds. One is an equity fund, the Housing for Health Fund, and then the other is a loan fund, the RX Fund, that we were able to launch with initial investment from Kaiser Permanente. And each of these funds provide capital for affordable housing development, and they require the use of a health action plan to guide those developments. The equity fund also requires a measurement aspect of evaluating how the residents are impacted over time. Although the loan fund does not because of the short length of those capital tools. But these are huge. This is a huge step forward for the healthcare sector and the affordable housing sector to collaborate in making decisions on development based on resident input and ensuring that those are paying off over time through measuring those results. And you see the 5 logos of the affordable housing developers who currently are participating in one of these funds or the other, and we're looking forward to growing these over time. So if you move to the next slide, you can see some examples of the different types of interventions we see some of these developers choosing to input in their property based on the framework. The categories at the top are the 5 different categories that we see are most often available for affordable housers to use to actually impact health through their decisions in development. And then if you move to the next slide, you'll see some learnings from the strategy selection that we've picked up from an evaluation that we did of this pilot that really boil down to weighing choices based on impact, evidence-based, feasibility, and cost. Then if you move to the next slide, you'll see some of the outcomes of our evaluation pilot, which even with developers who were prioritizing health in their properties from the beginning, really found an elevation of health in their residents through participating. And then if you move to the next slide, I'll just really highlight for you that developing strong partnerships between the 5 different entities that you see here, the developer, residents, community members, designer, and public health are essential for success. And if you move to the next slide, I'll just wrap up by sharing that measuring impact of the project of the framework is critical also, so that you can ensure that you're having the results that you would like by looking at evaluation metrics through design, operations, and self-reported resident health data. So if you move to the next slide, I'll close and just by showing you some places you can go to find additional resources for this information, and really happy to follow up with anyone afterwards to provide more detail over what I've covered here today. So thank you.
Thank you, Krista. Good to hear about the progress both on the health action plans and the equity and RX funds that you have managed to put in place with Kaiser Permanente. I think that's a potentially great model for others around the country, and hopefully some of the organizations on this call will be able to take advantage of those opportunities. Next, we're going to hear from Neil Steinkamp, and this is going to be a little different. It's a focus on a specific contaminant, in this case mold, that Neil and the team at NYCHA, the New York City Housing Authority, took on as a challenge in their many units around New York City. So we were very interested to hear and learn about the protocols and the regimen that NYCHA set up to address this very specific challenge that has very significant health impacts. So Neil, over to you. Thank you for joining us today.
Thank you, Michael. Hello, everyone. We'll go to the next slide. As Michael said, I want to share some information regarding the standard procedure that NYCHA is implementing now that is commonly referred to as mold busters. But let me provide a little bit of background first so we can appreciate the scale of what this program is intending to do and better understand what it has done and where it will go from here. So we're talking about 500,000 people roughly that are housed at NYCHA, obviously the largest public housing authority in the U.S. And is a population roughly the size of the entire cities of either Boston or Miami. So as I know everyone on this call appreciates, the scale of this is significant. Approximately 300 developments, 175,000 apartments across the 5 boroughs of New York City. We'll talk mostly during the next few minutes about mold. At NYCHA in 2019, we saw approximately 35,000 mold work orders, so a significant number, obviously, most of them requiring some form of relatively complex remediation activity involving skilled trades of some form. We're also considering, I'll mention this near the end of the presentation as well, how this same concept can be applied to the nearly 300,000 leak work orders that NYCHA experiences on an annual basis as well. Same concepts, similar benefits, and we expect similar impacts as well, but mold presented the first and a critically important step in reducing the contaminants in the units. Let's go to the next slide. So the mold buster standard procedure really sits on three really critical and key conceptual foundations. The first is a rigorous standard inspection. And we'll talk about that a little bit, but it's a standard procedure that is designed and intended to create a standard, that there's a consistent process of inspection and evaluation and work order creation, and there's a variety of benefits to that. But it's rigorous and it's structured. That improves the opportunity for staff to go through the process consistently and to have it fully and completely remediated. Obviously, a consistent remediation process follows from that, and then ensuring that there's a process of review through quality assurance, and then oversight and accountability to make sure that when that process is breaking down, that it can be redirected and corrected. Next slide. Really quickly, I'll hit on the high point of the impact of this standard procedure. Prior to the implementation of the standard procedure, NYCHA was experiencing recurrence rates for mold in the 20 to 30% range, which means that after completing the remediation work, mold was recurring that frequently. That's obviously a significant waste of resources and exposes the residents to a significant amount of risk associated with consistent, persistent exposure to mold. We have seen through the initial evaluation of this, which is obviously ongoing and continues, that those recurrence rates have dropped dramatically, down to the 2.5 to maybe 6 or 7%, depending on the method of recurrence calculation that we use. And there's good reasons for that. Again, the three pillars that we talked about on the last slide create a structure and a consistency, and then ensuring that the work is done correctly every time. And we have seen that by implementing that, dramatic reduction in recurrence, a better use of resources, a more efficient use of resources, a more cost-effective use of resources, and obviously, most importantly, better and safer housing for the residents. Next slide. I want to go through sort of what this looks like. I'll go through these slides quickly. As Drew mentioned, we will I'll receive these slides so you can review this. In addition, feel free to reach out. I do want to mention that this standard procedure was developed in part by the extraordinary contributions of Bill Southern and the team at Microecologies, who you see referenced at the bottom of this. I'll reference Bill on several occasions. He is serving as the independent mold analyst in the Baez litigation, which has assisted in the development of the standard procedure with NYCHA, and they have done truly extraordinary work to create this and to continue to refine it over time through the development of the standard procedure. So you can see that it uses a handheld, and it requires a variety of inspection equipment, a moisture meter, and a variety of other tools to ensure that all of the moisture conditions are being evaluated during the inspection. Next slide. We'll move through these pretty quickly, but I wanted to show some screenshots of what this looks like. So on the handheld, you have an app. You can sort of start your work order during the inspection. You've got the particular unit details, and then you jump right into evaluating the conditions. Next slide. You go through the process of obviously seeing things visually, but you've got a few key questions you're asking. Is there visible mold? Is there visible water damage? And is there a moisture measurement greater than or equal to 599, which is a threshold, very reasonable one. Frankly, if there's a moisture measurement, it's typically much higher than that. And so these are three key questions that help to identify, do we have a situation? Next slide. Then you go through the process of really evaluating that. What does that look like? What are the things that need to be done to correct the situation based on the answers to those questions? Next slide. Moisture conditions are being measured, right? Here's an example of that using the moisture meter, and all of the results of these are being recorded for every single inspection. The answer to every question, every measurement, they're all being recorded, and you have a phenomenal opportunity to use data to help inform this process. Next slide. Identifying root cause, as you can see here, there's a lot of questions that are asked about the conditions in the unit, what is going wrong, what is not working correctly. Next slide. Conducting wall breaks. There's a whole bunch of steps here in the process. I've only highlighted a couple just because of the time that we have, but there's lots of ways to make sure that you're guiding people through the process. What is required? A wall break is a great example, but also this continues to highlight for us the needs for just regular review and training. But the structured data gives you the opportunity to see how frequently things are happening, whether they're getting done correctly, whether the remediation is working correctly. Next slide. Submitting the inspection work orders to go through this process. You've completed the work order. There's these validations to ensure that the resident has the opportunity to sign for it, the maintenance worker, the supervisor, everyone, there's a role for accountability in the process as well. And then you selected the create child work order, right? So there's an automation process based on the answers that you had for the inspection results. It will automatically create the necessary child work orders, and those are all mapped to the answers to the questions and the conditions that you evaluated during inspection. Next slide. And as I said, all of those are automatically generated, and then one by one they are completed. Important here is at the end of the process, once you've completed all of these work orders, there is a quality assurance work order that is also generated. So you finish the remediation process, there's a requirement that the property management supervisor or assistant supervisor goes back to the unit to evaluate whether the work was done correctly. And that has been an incredibly important and incredibly valuable part of the process to ensure that it's done correctly. And that is what is ensuring that recurrence is not happening, because you're making sure that the work is done right the first time. Next slide. A few insights here, some of which I've touched on through the course of my comments already, and I know we have a limited amount of time, so I won't go through these individually, but as Drew mentioned during some of his remarks as well, there's so much value in the data and for an iterative process. And that is what the Mold Busters standard procedure is really allowing for, is the opportunity to see, is it working across the portfolio? And when it's not working, you have the opportunity to respond to that, refine it, evolve it, and we've continued to do that, working with microecologies to understand what's not working and why, where there are opportunities for retraining, where there's opportunities for changing the standard procedure. And that's an ongoing process, but you have to have the data and you have to have a process around that to make sure that you can do that. Next slide. Here I've just laid out some of the costs and benefits. You know, as everyone can appreciate, doing mold remediation right the first time has a tremendous number of benefits, both fiscal, social, and health related. The costs of those are outlined on the left as well. Of course, there are some, as there are with any of these programs, but the ability to and the importance of measuring things and evaluating things, which Krista mentioned as well during her presentation, just critically important to all of this. So that structured data and a structured process becomes really, really important. Based on the results that we're seeing here with the Mold Busters program, we are working to implement this same sort of concept across the portfolio for leak work orders as well. So we're really looking forward to that in the months ahead. Next slide. So my contact information is provided there. Certainly welcome anyone reaching out with questions, comments, or ideas. Thank you.
Thank you. Thank you, Neil. That's just great work. We're going to keep moving. We're going to now go to Ruchi Shah, who is with the Tenderloin Neighborhood Development Corporation in San Francisco. And Ruchi manages their portfolio-wide sustainability program, 43 properties in the Bay Area. And she is their senior sustainability manager. Over to you, Ruchi. Thank you for joining us.
Thank you, Michael, for having me, and good afternoon, everyone. As Michael already mentioned, we are in San Francisco. We have been building affordable housing for over 35 years. And we not only build, but we operate and manage. So we look at the whole life cycle of affordable housing. And our operating philosophy has been that housing is a basic human right. in moving forward, it's not just to provide access to affordable housing, but we need to look at health, energy, and other aspects of sustainability holistically. And given in the new reality we are, health is not at all an optional category now. In terms of our demographics and who we serve the most vulnerable population in San Francisco. People making less than $20,000 a year is majority of our population, and imagine surviving at that salary in the city. We are located in 8 San Francisco neighborhoods and are growing at a very high pace. As we speak, we have 43 buildings and 11 more in development. Beyond housing, a lot of our work comes in the form of services. We have a comprehensive urban agriculture program. We have our own People's Garden, which is open for community. Through Urban Ag, for every building, we have dedicated health and programming activities, access to produce, and we also have social services on site for every building. So we look at housing holistically. Next slide, please. In terms of sustainability and what it relates to my work, right now we have 5 goals organization-wide, and I'll talk in a bit how those impact new construction as well as our current portfolio. But as part of BBC and our commitment through Department of Energy's challenge as well as our partnership with HUD, we are committed to reducing energy and water throughout our portfolio. We already met our first target in the first 10 years and we renewed them. We are also, given that we're in San Francisco and there is a tremendous focus on compost and recycling, that's one of our goals, is to increase waste diversion and engage residents as part of that. Recently, we started measuring carbon because often that was left out of the equation and we focused too much on just energy. We also have a goal to, for every new building being built, look at solar PV. Traditionally, we are focused on solar thermal because we had a lot of gas-based systems, but moving forward, we are building all electric, even though it's not a code mandate yet. In San Francisco, we know that's coming our way, so we are already preparing, and that has a huge impact in terms of reducing combustion on site. We're kind of eliminating it altogether. And then, as Krista mentioned, with enterprise standards and other certifications and rating systems, we are adopting a goal to have Green Point rated or LEED, and we are looking at different levels in terms of what we can achieve for every certification, not only because in most cases it's a funding requirement, but that's the standard we want to have for every new building we build. On a case-by-case basis, we are also starting to look closely at occupant health-based design approaches, and many of them are being focused in terms of operations, but we are looking from a design perspective from the get-go what could be achieved. So I'll talk a bit on one of our FitWel pilot that we are doing. Next slide, please. In addition to the goals, we have 2 ambitions, which to us are what we can do above and beyond. And we are starting to focus on healthy building materials. Some of these things we have been doing, but we are taking a holistic approach as part of our design guidelines. And I'll share that in a bit with our partnership with Home Free and Healthy Building Network. Currently, we are, it's a great timing because we are updating our design guidelines and we are incorporating what we want, what we do not want at all in our buildings, and also going deep down into, based on our research, based on what we have put in our buildings, we are recommending products. There are some open-ended items and specifications too, but where we know what we want, we are clearly saying to our architects what to specify. And this is embodied carbon is sort of a new approach too that we have started taking a closer look at since last year. All electric building is one strategy on operational carbon, but in embodied carbon, healthy building materials are a part of it to see what could we do in terms of low carbon, because these things once we decide what we put in the buildings, the carbon is locked because we're not going to change insulation down the lane. One of the key areas we are focusing on is concrete. A lot of our buildings, given the type of development we use, are very heavy in terms of concrete usage. So we are working with our structural engineers to increase the amount of supplemental cementatious materials, meaning less concrete and more of other things which have low carbon impacts. And insulation is also a key focus for that approach. Next slide, please. In terms of opportunities, we are seeing these sort of three buckets where our work on sustainability and health touches each other, as well as there is a great amount of overlap, as Drew and Krista and others already mentioned. From a design perspective, we can do a lot in new construction. Also, as our buildings get older and we do substantial rehab or retrofits, we are taking a closer look at what materials we are putting in. And then a lot in terms of mold remediation, leak detection, and other things gets looked at in operations and maintenance. And from where I sit in property management, and I closely work with facilities team to sort of make sure we all are talking to each other, not operating in silos, so that there is a clear chain of communication between these three areas of work. Next slide, please. As I mentioned, as part of our goal, our baseline standards are LEED and Green Point rated, and they also touch on many of the health, indoor air quality aspects, which gives us more comfort with every new building we are doing better. We are making sure that the standards are maintained. In terms of what more we can do beyond these is that we are looking at FitWel, WELL, and Living Building Challenge standards. Not necessarily every new building has to meet the certification. And I don't think the key is to meet certification, but is to look at these approaches and see what could be adopted. So we are taking a closer look at that as part of our design guidelines, which is happening right now. Next slide. So as I mentioned, we have one project in new construction that is looking at FitWel design certification. In a sense, FitWel is a building certification that looks at design as well as operational strategies to support health and well-being. And it's really dependent on what population are we serving and where we need to put more focus on. The good part about the certification is that there are no prerequisites. So right now at this stage, as we are exploring, it gives us a good sense of what we are already doing, where we are validating our approaches versus where we need to push ourselves further. They have 7 categories, and in each category, several evidence-based strategies. For us, we decided to do FitWel in sort of mid-design phase, so it was not the goal from the get-go. In mid-design phase, we learned that this could be a great opportunity. Let's just try it out. So we started working with architects, and some of the, currently just based on our design, we are at 1 star. We are still having ongoing discussions on can we achieve 2 stars or 3 stars, but it's not sort of a funding requirement or anything. We're just doing it for our own knowledge and just to validate our design approach. In the project, the good part was the registration and certification fee is not that expensive, but it takes up a lot of due diligence, paperwork, and documentation. And our architects were really generous to share the costs because, as I mentioned, this was not planned from the get-go. I just want to quickly highlight, though the project that I'll mention in a second did not go through Fannie Mae's lending. We had a separate lender, but for other projects already going through Fannie Mae as their lender, this might be something really interesting because they have basis point reduction if the building gets FitWel certification. Next slide. So the project is 681 Florida. It's 130 units in an urban setting, 9 stories, so high-rise residential development. The population type is going to be families, formerly homeless families, And the goal of this building was to sort of ensure that Latino families, this is a mission neighborhood in San Francisco, were not being forced out as part of urbanization approaches and what's happening in the city. So it has a mix of studios up to 3 bedrooms. Next slide, please. So here's a quick snapshot on some of the things which we are doing anyways as part of our urban ag programs, as well as just being in an urban setting. We are having a great walk score, proximity to transit, and things like that. But in terms of what the maybe areas and the no areas were, we are still exploring what could we do more in terms of outdoor fitness. This building has rooftop garden, but we don't traditionally have an exercise room in our buildings, just because real estate, as you know, in San Francisco is super hard to manage with all competing needs and priorities. So we are looking at maybe can we get funding for a few bikes, stationary bikes and things like that. In terms of the no parts, water quality is something that we don't do active testing. We just rely on city's source, and we have water outlets in our buildings. So we are seeing what would it take for us to do sort of an additional quality testing. We are working with our urban act teams to see what can they do for healthy food and beverage policies. Usually we have a standard vending machine and they have things to Cheetos and whatnot. So can we be more strategic about what we offer to our residents? And also, it's not here, but one of the things we're actively discussing as part of this project, but overall organizational strategy, is smoke-free buildings. Right now, we only enforce no smoking in common areas. So we are trying to think, can we enforce that? We have to talk to city in terms of in-unit no smoking as well, because as we do our post-occupancy surveys, as well as when we talk to residents, some of them have real concerns about smoke being transferred into their units as part of ventilation. So we are tightening our standards on that too.
Hey, Ruchi, I think we have 1 more minute, and then we can move to our next speaker. This is all great. Thank you.
Yep. Can we move to the next slide? Yep, I'm almost at the end. Yeah, and just quickly highlighting with healthy building materials, part of specifications, we are looking at several of these programs and certifications. And next slide, please. I can give a quick snapshot of what we are doing with Home Free. So right now in our basis of design, we are taking this traffic light chart approach for many categories to say what's in green, what we want, and we are asking architects to take a closer look as they specify products. Next slide, please. So lastly, with my presentation, I really want to spark that we have to move beyond being hopeful and really focus on taking action as we are in the midst of a pandemic. So thank you, everyone, and happy to answer questions.
Thank you, Ruchi. That's great. Unfortunately, we didn't have more time to get into that the home free slide, but I think we'll get some more information from Roberto Valle Kinloch, who's going to now talk through some of the issues related to material selection and their which is really the work that the Healthy Building Network is doing through the Home Free project. So Roberto, thank you for joining us.
And thank you, Michael, for the opportunity to be here and share about the work that we're doing at HBN and specifically Home Free, right? And for those of you who are not familiar with Home Free or HBN, we are a nonprofit that we've been around for over 20 years, and we have the mission to advance human and environmental health. And we do so by improving transparency on hazardous chemicals, but also by inspiring healthier product innovation. The way that we work is we leverage cutting-edge research on product materials and their impact on health. And we use this information and this knowledge to develop products and ultimately build the capacity of stakeholders in the construction industry so that we together we can make better decisions about the materials that we specify and ultimately use, right? Now, Home Free is HBN's national initiative focused specifically in working with affordable housing leaders, called that architects, developers, contractors, building owners, managers, right, who wish to improve human health by using less toxic materials. Slide. Yeah. And when we discuss, and this is something that I want to address, when we discuss strategies, for example, to deliver sustainable green buildings, it's not uncommon for conversations to gravitate towards accounting for strategies that involve energy and water efficiency technologies and measures, including the adoption of passive design concepts. We talk about responsible sourcing and efficient material use, including, for example, using wood that is certified or materials that can be reused, recycled, or composted. We talk about strategies that can help to minimize or avoid, even better yet, right, waste and pollution that originates from the operation and the maintenance of buildings. And this is all really important, but one aspect, critical component that is often missing from this discussion is how the toxic chemicals, right, that are found in the building products that we use to achieve or to pursue these strategies, they can hinder our overarching sustainability ambitions, per se, right? And if we have to put it in another word, when we talk about sustainability in the built environment, and Ruchi mentioned this, right? We're talking about delivering buildings that are not only energy efficient or that use less or emit less greenhouse gas emissions, but we have to talk about creating healthier communities, be that healthier homes, healthier playgrounds, healthier schools, right? So that all people, children, can work, live, play, and learn, more importantly, right? In environments where they are not continuously exposed to chemicals that have the potential to increase the risk of cancer or affecting their reproductive, respiratory, this was off, systems, and even affect their learning or cognitive abilities. And this is crucial, right? Because we have a problem with an achievement gap in the education system, and if the construction industry remains being toxic as it is, then we just become a silent contributor to the problem. This needs to be acknowledged. And this is truly a matter of equity and justice, and I just want to make this very clear, because these chemical exposures are particularly and disproportionately affecting low-wealth households, communities of color, who not only have to pay high bills, energy bills, because of the conditions of the affordable housing building stock, but also have to suffer from the compounded negative health impact of not only having to live in these houses, but having to work in the manufacturing or in installation of these toxic products. Slide. So bringing it a little bit closer to home, and no pun intended in this, is when we're talking about the relationship between chemicals and energy and climate, we tend to also think about first the usual suspects, right? Carbon dioxide and methane, and how they contribute to climate change. And these are really good examples, but we also need to think about, well, yeah, you don't know what you don't know. Chemicals that are less known that live in the world of building materials. And we can talk about, for example, fluorinated blowing agents that are used in some forms of home insulation. And these agents have either a high global warming potential or use chemicals in the production of these agents that can actually have also high global warming potential. And a recent report by the Ellen MacArthur Foundation highlighted the importance of considering product cycles as we think about climate action plans. And this is really important because the report argues that even if we focus on renewable energy transitions and energy efficiency strategies, right, that are very important, I think, and core to consider in a circular economy context, they can only address 55% of the total current emissions, and then that leaves another 45% of emissions that come from producing the products that the cars that we drive, the clothes that we wear, or even the building products that we use, right? And the problem or the dynamic between toxic and chemicals is more of a vicious circle, because as we continue to release these toxic chemicals and increase climate change, global warming, higher temperatures, and the disasters, what they lead is to changing the way that the toxics behave and that they get distributed and released into the environment at the same time, right? For example, warmer air what can lead to the breakdown of toxic chemicals into toxic byproducts. It can make some chemicals to vaporize and just enter more easily the air that we breathe. And disasters or like fires or hurricanes can destroy homes or factories that just end up releasing higher concentrated doses of toxic chemicals into the environment. Right? Next slide, please. So what can we do, which is sort of what we're here today, right? What can we do with our partners in order to address these issues and to make use of healthier materials and energy efficiency upgrades? So I'm going to talk about three things. These three things are related to the partnerships and the collaborations that we worked recently, right? So one is we can work to improve our understanding of the products that are using energy efficiency upgrades, identify healthier options so that we avoid the problem of regrettable substitutions, and support the innovation and diffusion of these products. Second, we have to engage with the manufacturers and demand increased disclosure and transparency, and you can do so by requesting products that have health product declarations or declare labels, but transparency is still an issue, right? And we need to work towards that. And thirdly, I think it is important that we support and we pursue certifications that value, that promote healthy building materials, right? So over the past few years, we have teamed up with, for example, the National Resources Defense Council and Energy Efficiency for All, and we collaborated in improving our understanding about air sealants and insulation material, but also to formulate specific, simple, actionable recommendations that can actually be used to encourage their use in multifamily energy efficiency upgrades. The reports or the findings are contained in a couple of reports that you can find at Home Free or at the home of our partners. And we are happy to announce that we'll also be moving to a second phase, which is more action-oriented, taking these recommendations and actually helping to see how we can use these recommendations at scale. Also, we've collaborated with affordable housing and developers like Preservation of Affordable Housing and Tenderloin Neighborhood, I'm thinking TNDC, right? And we work a lot with Ruchi, who's truly a champion of champions. And two of the products that we've worked on is in, for example, reviewing material specifications regarding insulation and air sealants, identify what products contain some chemicals of concern, identify healthier solutions, and sort of make those healthy substitutions. But the one that I'm also excited is the one that Ruchi mentioned, is that is material specification guideline that they can use to engage with architects and their contractors to sort of prioritize these healthier solutions. And Ruchi, we need to talk about how to put this in a format that is accessible for everybody, right? And finally, I just want to say that regarding green building certifications, we are thrilled to have partnered again with Enterprise Green Communities in supporting the development of their criteria of 2020, particularly by providing recommendation on the material section. Slide. I just want to highlight very quickly some of the free tools and resources that we have at Home Free that you can use today to improve your understanding about these healthier products and understand how to specify healthier options, right? If you have to do one thing, go check the hazard spectrum, which as Ruchi mentioned, is a simple traffic light approach to understanding and ranking materials depending on their toxic chemical content. And you can just see where you're at and move a step or two towards a healthier practice, right? Simple. Check out our courses as well. And anyways, I'll talk more. You could please reach out. Slide. I'll just finish by saying that really come ahead, visit Home Free. We have our products and it's all evidence-based, is rigorous research, and it's free for you to help you improve your understanding and how you specify materials, right? So visit, learn, apply, share with your peers, and give us feedback. At the end of the day, we're in this journey of really continuously improving. Take into account that this is not research, this is research powered, but it's guided and shaped by a group of Home Free champions who are experts in affordable housing development and architects and other intermediary organizations. So do reach out, say hi, and we'll keep on working. And I'm done. Thank you.
Thank you, Roberto. Much appreciated. Thank you to all of our speakers. We're now going to do the discussion and Q&A. We have 15 minutes or so. Becca, you're going to do a quick Slido poll.
Yes, thanks, Michael. So, okay, as we did before, we're going to do one more Slido poll. So please go to slido.com and type in the event code #DOE to access the poll. And if you're already here, you should see the second poll question up on your screen, which is, what barriers do you face in incorporating healthy housing measures into your energy retrofit projects? For example, financing, lack of information, resistance from leadership, or resident engagement. So we'll give you a few moments to go and type a word in, and it's going to pop up in a word cloud. So far, no surprise, financing is the largest right there in the center. We also have lack of information, which is coming in second. Leadership, I see a few of those. Affordability of housing materials. Again, resistance from leadership and financing still in the lead. We've also got a learning curve for contractors, a lack of comparables, split incentives, always a big issue in multifamily housing, and then skilled labor and stakeholder buy-in. So a really good group of barriers that we have here. So thank you everyone for chiming in. It's really good for us to hear your feedback, and that can be used by us when we're looking to do programs and provide additional resources.
Thank you, Becca. Okay, we're now going to do a little bit of discussion with the panelists and then get to your questions and answers. Thank you all for hanging in there. So if the rest of the panelists can get their video links activated, that would be great. The first question we just wanted to go to, I know this has been a topic in the Q&As as well, which is the COVID connection, which of course is front and center for many of our projects, all of our projects. So the question we wanted to unpack with the panelists was, how has COVID changed? What specific or general changes have you made in the management and operation of your buildings? If we could just go to the next slide before I call on a couple of the panelists. We wanted to point out that there's a lot of good information, not necessarily complete consensus, but in particular, ASHRAE has packaged a very good guidance on what you should consider in your multifamily building, both immediate actions, some specific things that you could and should be considering, longer term upgrades, and then resident education. And we've pulled out a small sample here just for your information, and would recommend that you go to the link at the bottom, which we will post on our website for more specific information. In the immediate actions space, of course, there's a lot to do with informing residents about good social distancing and practices in common spaces. I'm sure all of you are already doing this who are involved in multifamily management. Looking at portable air cleaners with HEPA filters, going to MERV 13 filters wherever possible, both in central systems and dwelling units, etc. I won't take more time on this, but if we could go to the next slide. We provided some links here to first the ASHRAE guide, as well as other materials from the Institute of Architects, CDC, and then we've posted quite a few additional materials on our HUD Exchange Better Buildings Challenge website. So some good resources there, and we will certainly be doing more webcasts and training in the future on this specific topic. But perhaps, Neil, did you want to take the question first, which is how have you changed, has NYCHA changed your practices and some of the things that you've done to address the COVID-19 situation?
Yeah, thanks, Michael. As I think everyone would expect, there are many things that have been contemplated and changed and adapted as a result of COVID-19 across the NYCHA portfolio. I'll touch on a couple. The first is obviously ventilation. I know that was a key focal point of the first poll question that we had, and is an issue generally anyway, but in this moment, ventilation is obviously critical. Working with Bill Southern again and microecology, who have really provided a tremendous amount of insight in terms of airflow and the importance of ventilation. That has been a key focal point across NYCHA to try to maximize airflow in the units and to improve ventilation. And there's a number of ways that can be done. I think there are some additional considerations as we get into the summer months and air conditioners start to be used. So I know Bill and others are trying to provide as much guidance to residents as well as to NYCHA staff about how to improve airflow and ventilation in the units. One way that we do that through the mold busters inspection is that every single mold inspection has a question about airflow. So in my presentation, I mentioned 3 key questions that those inspections require. Those were, visible mold, visible water damage, or a moisture reading. The 4th question that is asked is related to ventilation airflow. And so by identifying that in every single unit you go into, you can see whether there's an issue in ventilation and airflow. You can make sure that the roof fan is inspected, repaired, replaced, whatever it is, to make sure that that's not only impacting that unit, but all the units in that building line can be improved. So there's a lot of focus on that. The other one that I'll mention is implementing virtual inspections. And so we've tried from the very beginning when the COVID pandemic was really taking off in New York in mid-March, we began to think, how do we maximize safety for both the resident and for the staff? And one of the ways that we began doing that is to use really video conferencing techniques using mobile phones, right? So a lot of residents have mobile phones. It's not all, but a lot of them were beginning to use the Zoom app even for communication with friends and family. And so we began to pilot ways in which we could have a video conference with a resident to see what their conditions look like, to do an initial video inspection. Obviously, you can't do repair work by video, but at least that way you're better prepared for what you're going to do, and you can be communicating with the resident about what safety precautions can be taken as you do go to the unit. And that was a very, very well received, and we piloted that for several weeks and are beginning to implement that across the portfolio now.
Virtual inspections, that's really interesting. Drew, Codman Square,
Sure.
you have a number of properties that you're focusing on.
Yeah, we've had a lot of changes on the property management side. I think a lot of it, obviously, the immediate response is more cleaning. Looking more at, instead of a lot of our facilities, we don't have a lot of ventilation. Most of our heating systems are forced hot water systems. So we're looking more at reducing contamination through, touch. So in other words, front doors that open automatically, faucets and fixtures that, are automatic. The other thing is, I would say, is the inequities that became apparent because of the COVID crisis were real clear to us, as we're predominantly a Black community in Dorchester, which is part of Boston. And so we realized that we needed to we plan on doing more resiliency and communication with our residents. What that might mean, you know, getting people computers and access to that as a, in case of you know, other types of emergencies. But also in the long term, doing more economic development classes and getting people into other types of jobs that don't necessarily have to be at such high risk, or you know, even just make sure they're getting proper training as they go into those types of fields. And I think the other challenge is, I think Neil mentioned, was doing like virtual meetings and inspections, and but that may be a good thing for us in the long term, where we do more case management with the residents virtually, which we weren't doing at all before. So some good things may come out of it.
Great. Anybody else have anything to add on this? Ruchi, your work in San Francisco?
Yeah, absolutely. And many things are very similar to what Neil and Drew mentioned. Just additionally, at least our offices, many of our offices are in our buildings itself. So we are upgrading to more 13 filters, and also like taking a closer look at ventilation. That's a key strategy for us. Also, TNDC is providing free masks to all residents, because like Drew mentioned, inequity could be, or access to these items could be a key challenge too. So we are trying our best in terms of resident education too, making sure there's lots of signage in different languages, to ensure that people are getting aware as much as possible.
That's great. Krista, I just wanted to ask you, the whole issue of ventilation, are you finding that your existing enterprise green community standards are working, or are there some additional concerns or issues or interventions that you're looking at or considering?
It's a great question, Michael. In our Green Communities program, for any new construction properties that certify, we require that they install ventilation systems according to ASHRAE 62.2 or 62.1. So those are mechanical ventilation systems that will, you know, ensure the airflow. For rehab projects that come through our program, it's an optional criteria, not required, because of the costs associated with retrofitting a new mechanical system into an existing building can be excessive. So I think what Drew and Neil and Ruchi were talking about here touches on some of those challenges.
Great. Your dog has some ideas on that as well, it sounds like. The hazards of doing the webcasts in the COVID era, but it's great. I think we're going to have to go to some Q&As. Becca, did you want to just bring out a couple of questions for the panelists that we had on Slido?
Sure, thank you. So we've had a lot of great questions come in. The first one is actually for Drew, and that is, how can affordable housing organizations team up with hospitals to fund health or energy interventions?
Okay, that's a great question. Well, the hospitals have a requirement at being, most of them, almost all of them are nonprofits, and they have to put some of their funding into the community. And they're realizing that their costs for particularly homeless people and keeping them housed is a huge cost. I think I was reading a statistic that on average a homeless person comes in for 3 days and it costs $90,000 for 3 days. I was like, wow, that's staggering. And so you add that up over the course of a year. Boston Medical Center said they had $1 million homeless people. It cost them $1 million. So to them, putting $1 million into a development so that they can stabilize housing for dozens of or more of these types of residents, homeless individuals, it will save them money. So I think it's a matter of connecting with your local hospitals and the leaders there, and reaching out to them. And I mean, you want to plan too, you know, and I think the key is around the homeless population, because that's where they're seeing their expense. Statistically, it's somewhere between 20 and 25% of our healthcare costs. If we could stabilize homeless housing for homeless people, would reduce our healthcare costs. So it's a big number for them.
Great, thank you, Drew. So this is for anyone on the panel. We've had a few requests. Could anyone speak to the energy efficiency measures that you think are most tied to health improvement? So if you had to choose maybe the top few you'd recommend.
Can I start by just maybe answering a big picture wise, and then let others answer? I think, you know, reducing the energy efficiency of your buildings reduces greenhouse gas emissions, which improves health of people on the planet. So like big picture wise, investing in energy efficiency relates to improved health outcomes in whichever way is most appropriate for your project. But be happy to turn it over to others on the panel to share their favorite specific intervention.
I agree with Krista. It's all interconnected, and for us, our strategy on new construction, all electric, is a huge energy efficiency strategy, as well as in terms of health impacts and mitigating impacts related to combustion. Also in new construction, we are toying with the idea of, can we move away from electric resistance coils to even induction? I'm fully aware that it's an expensive thing. Tenants needs to be educated to have right pots and pans, but we are considering that as we are building so much new housing. And in retrofits, I think thinking actively about, as equipment, boilers are coming end of its useful life, can we electrify those systems? TNDC has not been using gas stoves for a long time. What can we do further on that?
I just want to add, I think the best thing in terms of finding out what the biggest health impact for your residents is creating a health action plan. So for the property that I was demonstrating, we use this Enterprise Communities Health Action Plan model. It's a great tool. It's not too hard to use and put together, but every property has unique challenges, every resident. So if you're in the city, you might have ventilation or noise issues, but in the country you might have one or the other, so you might have a different focus. So it all depends. And I think that starting with the health action plan and finding out what your residents are interested in too can be helpful.
Thank you. Becca, I think we're going to have to leave it at that, since we're pretty much at our end point here. Unfortunately, there are some other questions. We will try to get to those afterwards, and we can post the responses online. So over to you, Becca. And I think the panelists can stay with us on the line or until we wrap up.
That would be great. So for our final slides, we just want to highlight some different resources and events coming up for you. So in addition to our on-demand webinars library, the Better Buildings program recently launched its e-learning center, which is a collection of webinars, courses, and other e-learning resources covering a range of areas relevant to Better Buildings, Better Plans partners. So please check out this helpful collection of resources on the Solutions Center. Next slide. There are 3 more webinars left in the summer series, and in this series we are taking on the most pressing topics facing energy professionals, with new experts leading the conversations each month. All previously recorded webinars are archived in the on-demand webinars library. Next slide. As a reminder, the slides and recording from today will be archived on the Better Buildings Solutions Center. Please revisit the slide deck to access the resources that we discussed today. And we have several resources highlighted on the screen right now that we talked about today and we recommend. Next slide. We hope you will join us for the next webinar in the summer series happening tomorrow. Join DOE's Plug and Process Load Technology Research Team for a technical presentation about a statewide plug load strategy developed by the Oregon Department of Administrative Services and the Oregon Department of Energy. Next slide. So to find more resources from the Better Buildings program, please visit the Better Buildings Solutions Center. You can explore by topic, solution type, or go to one of our program and partner pages directly. Going to our Partners tab will lead you to our sector pages. Clicking the multifamily box will take you to our multifamily sector page. And here is where you can find our multifamily page filled with various resources. It has a list of our solutions and then other links to helpful resources. So go to energy.gov/BBSC to explore all of the Better Buildings Solutions Center has to offer. Next slide.
Okay, I think with that, we're going to wrap up. I wanted to thank the panelists. We'll try to get you back for more questions at a future session. We will be taking a deeper dive into some of the subjects that we discussed today. Thank you all panelists for your great presentations, and look forward to having you back at a future time. For those of you who would like to sign up for or join us for our July 23rd Help at Home rehab program, which is this Thursday afternoon, go to Health at Home at HUD Exchange, and you should be able to find that information, or drop me a note at michael.friedberg@hud.gov. So thank you all. Thank you.